I'm very honored to be here to talk about physical therapy for back pain. I was actually going to present this with Katrina Rodenkirch. She's another therapist that we work with closely here in at the VA. And she gave me the permission to just share. You know, she had a medical emergency. She would let you all to know that she is doing well and recovering, and she is missing presenting with me here. Okay, so we are going to talk about physical therapy for back pain. So some disclaimers before we begin. Any movement or exercises we discuss in our presentation today are not considered medical advice or medical treatment. So please confirm with your PT or medical provider if you have further questions or concerns, okay? And also for Katrina, she is a VR virtual reality guru here at the VA. She also wanted to disclaim that for the VR trip, which is an application for virtual reality, she is getting about 120 days of three free trip licenses. So that was this disclaimer before we begin. So the objective for tonight is we're going to talk about how physical therapy as a resource for low back pain, what we know about pain. So you may have heard about chronic pain versus acute pain. We will go over that a little bit more in detail today, maybe a quick review. We're going to talk about a little bit about a brief review of anatomy, of the back anatomy. We will talk about we are bioplastic. So in the upcoming slides, we will explain what bioplasticity is. We'll talk about how your spine is actually quite resilient, okay, despite having pain and maybe even chronic pain. And we're going to talk about some active management of spine pain is best evidence. And that includes some simple movement that I will go over towards the end of the presentation. And also active management is all of you sitting here with us tonight, actively engaging, okay? So that is also considered an active approach to pain care, okay? Now, what does a physical therapist do regarding low back pain? Some of you may even have had experiences with PTs in an outpatient setting. So our role in the healthcare system is to help restore movement, right? Strength and function to the body. So we view ourselves as movement specialists, right? Because we often know and understand how pain can impact one's ability to engage in their various activities. So we are trained to help that individual or the patient to restore that movement via exercise, education, so we can get back to some of those activities that are valuable to you. Okay? We can perform physical evaluations of spinal movement, strength, and nerve health. So coming in, if we see each other face to face, in addition to subjective evaluation, getting a good history, we will also do an objective measurement, testing your strength, range of motion, balance, watching your gait, for example, just overall how you're functioning and moving. And what that may look like after pain, right? Because you may be moving a little bit differently, guarding perhaps. And then based on that, we create a tailored treatment program to each patient, okay? Because we are all different individuals, we all come from different backgrounds, different ages, even. And not every specific exercise or approach will fit everybody. I wish it was that simple, right? So we really have to take each case on an individual basis. And we work in a healthcare team and refer to other specialties when necessary, especially here in the program that we run, IPRP, which is the intensive pain rehabilitation program. Chronic pain care really takes a village, right? PTs are involved in addition to behavioral health specialists or pharmacists, doctors such as Dr. Chang, occupational therapists, dietitians. So we want to cover all the bases regarding chronic pain. So we do work in the healthcare team. It's very interdisciplinary, okay? And we find that approach is best for outcome measures. So what is pain? So pain is a lived experience. It's an interaction of changing biology, psychological and social components that affect all aspects of our lives. And acute pain, we know that is an initial injury, or if you come out of surgery, if you have surgery, post-surgical, that's considered acute pain. If you sprain an ankle, you feel pain or experience pain, you may have some inflammation, that's considered acute pain. In chronic pain, however, is pain that's lasting greater than 3 months, long after initial injury or illness has healed or gone away. So this is pain that may be going on for months, years, even decades, right? But this type of pain, we can't attribute to an initial injury, and yet this pain is very real. So let's move on to some basic back anatomy, because this talk is really more geared towards low back pain. So in the backs, there are 7 neck vertebrae, okay, or we consider that the cervical spine. There are 12 mid-back vertebrae, or the thoracic spine. There are 5 low back vertebrae, which is the lumbar spine. And then we have the sacrum, which is a triangular bone at the base of the spine, consists of 5 fused bones. And the end of the sacrum is a tailbone, it's 4 to 5 fused bones, or what we call the coccyx. Now, along a spine, we do have muscles, right? We have these large, strong, lengthy muscles that when engaged, it helps to keep our posture erect and upright. And we also have shorter, precise movement muscles within our spine that helps us with rotations, for example. So these muscles involved in the back as well. Now, in between each vertebra, we do have what we call disc. And this, for many of you, may be very familiar, right? You all maybe have heard of slip disc herniations. So discs are these structures that helps with some shock absorption between the vertebrae. And I'm going to be talking about disc a little bit more in detail as we go along with this presentation. And within each vertebra, with each level of nerves, right, there's pairs of nerves that exist between the bones. And these nerves do exit out into the peripherals, right? If it's coming out from the neck, it's going into your arms. If it's coming out from the back, it's going into your legs. And I think we all heard of the term pinched nerves, right? That's when a nerve potentially is being impinged on by maybe a disc or a bone or both. And that may sometimes can create some nerve pain like sciatica, right? And lastly, there's fascia. It's a system in the body that holds the body together. I actually want to spend a little more time on fascia because we don't think that fascia gets enough attention, okay? Now we talk about the bones and the spine, the muscles, the discs and the nerves quite often, right? But fascia is something that are often kind of missed, doesn't get enough attention. And it does, it's actually a very important system in the body that we need to talk about, especially in pain, and low back pain and chronic pain. So fascia is a new way of understanding how everything is connected. So has any one of you ever like prep chicken or chicken breast, right? And we're trying to separate the skin from the chicken, and that this fine film that's transparent that you see, okay? So that's fascia. So we as human beings have fascia too, okay? So, so think of fascia as a connective tissue, is a structural stability system of your body that supports, connects, and stabilizes everything from skin to bone, head to toe. So think about it, it was almost like a 3-dimensional system here. And if we look at the image on the top right-hand corner, let's say the very top layer is the skin, the cylindrical looking structure, let's say that is a muscle or tendon. And look at what's in between there, right? You see all this little kind of web-like type of structure. So that's fascia, okay? So if you can kind of imagine that skin moving on top of that, that tendon, right? Kind of gliding up and down, side to side, even twisting, even compress. Kind of imagine, kind of visualize how that fascia system is moving, right? So it's quite interesting. So we find fascia at the superficial level, right? So if I kind of put my skin here, there's fascia underneath. Remember, fascia is everywhere. It also, we can find it very deep. It connects to bones as well. Now, some features of fascia, it is fluid-based, or what we call bound water. And this image is a very blown up image of what fascia looks like. So if you kind of look at it, it does kind of look, there's little water droplets almost, right? So it's very fluid-based bound water. It's made of collagen, elastin, right? You know, some of these words we may have heard from like cosmetics, right? You know, enough collagen, elastin, we kind of keep our skin nice from wrinkle-free. So it does have these components. It also has a higher hyaluronan, right? So what we call it is a sponge effect. And here's the most important thing in my mind, okay? There's over 200 million sensory nerve endings that live in this system. So if we talk about pain, low back pain, chronic pain in general, but we will need to give a little more attention to the system, right? Now, going back on the sponge effect of the fascia. So, you know, we like to use analogies, right? It's a little easier to kind of visualize and understand. So fascia, think of fascia like a sponge, right? You know, if ever one of you had like a really dry sponge, a sponge I haven't used in a while, right? To kind of sit in on the counter. And what does that dry sponge kind of feel like, right? It's kind of rough, kind of on the edge. And you try to squeeze it, it doesn't really have the bounce or elasticity, right? But what if we put that sponge underneath water and slowly kind of work that sponge within the water? But eventually that sponge will kind of come back into shape, and then you can start working again, right? Absorbing water and putting out water, okay? So we're gonna look at a fascia system as such, like a sponge. So I really like this visual here. So remember, fascia connects everything, right? It surrounds our bones, or even our blood vessels. So on the left image, on the left-hand side of the image here, right? So this is fascia that is not quote unquote hydrated, okay? So think of that as like a dry sponge, right? So if ever, any of you ever felt stiff in the morning, right? You're moving around, it's like, wow, that's really tight in my spine. So in addition to thinking about your muscles and your joints being a little stiff, no, also a fascial system is in play here, okay? So we'll look at that image there, right? Versus the image on the right, which is a more pliable fascia, right? So think about working the sponge underwater. It's more resilient and more elastic. You can notice that there's a lot more space for the blood vessels and the nerves to exit through, right? No, versus the image on the left, a dry sponge, okay? Now, how do we get our fascial system to be hydrated, right? And kind of working our sponge. Just general movement is great, okay? Stretching would be a great way to get our fascial system to be more healthy. You know, stretching, foam rolling, right? If you ever have any experience being on a foam roller, the fascial system, in addition to stretching, they love compression. So if it can compress and release, that can also work our fascial system, right? And how many of you have experienced the wake up in the morning feeling stiff, and after you move around a little bit, right? Stretch, so forth, we often do feel a little better, right? And we can't give all the credit to muscles and joints and tendons and ligaments. You know, our fascial system is also in play here. And that's why I wanted to spend a little bit more time on fascia this evening, because again, we don't feel like it gets enough love, it gets enough attention, okay? So that leads us to the topic of bioplasticity. So what does bioplastic mean? So all living organisms adapt, right? That includes plants, animals, humans. So this property is called bioplasticity. So bioplasticity makes us stronger if we lift weights, right? Smarter if we think a lot, right? Using our brain, right? Using brain power, reading, or even sitting here listening to me talking about low back pain and getting educated on these topics. It would make us a little smarter, right? Because we engage in actively. And fitter if we exercise. Now, I also want to note, there's also a dark side of bioplasticity, right? It's not always positive. So let's say if we don't move or we don't exercise, you know, we stay in bed all day, for example, right? Bioplasticity is also in play, right? Negatively, right? We've all heard about muscle atrophy, You don't use it, you lose it. So that is also bioplasticity. So think about the fascia system, right? When we do these movements, we're not just working on muscles and joints and tendons and ligaments, we're also working on fascia system so they can adapt. So that leads us to the SAID principle. So form follows function. So the SAID principle, SAID stands for specific adaptation to impose demand. So, and the reason why we have two images of the orca whale here to suggest the SAID principle in action. So on the top image is the orca whale in captivity, and on the bottom is an orca whale in the wild. And you notice anything different, right? The dorsal fin, right? The dorsal fin with the whale in captivity is kind of curled down, whereas the dorsal fin of the whale in the wild is pretty straight, right? And the reason being, the wild orca has a lot of room to swim, right? Its body is put on demand from different winds, different currents. You can even say different diet, right? Versus the orca whale in captivity, there's only so much room for it to swim. But the variables are not as diverse as the whale on the bottom. And hence, the dorsal fin adapts, right? Now, I'm not suggesting the orca whale on the top in captivity is less healthy than the bottom one. It's just to show the SAID principle in action. Okay. So, so as human beings, we adapt as well. Okay. So in the next slide, we'll talk about some images, right? So whenever we get X-rays, scans, CTs, MRIs, it may show some changes in the spine, okay? So, and that may suggest just normal signs of aging, okay? So bones do adapt in response to the loads they absorb during specific activities over a lifetime. So our skin shows signs of age with wrinkles and spots, okay? So this image here is of an older woman, obviously, right? Wrinkles on her face and her hands, and then a younger girl. So very different in skin, right? And we see that. So we want to view what's going on inside the body, right? That whenever we take a scan, X-ray, and we see spurs or osteophytes, or these are terms that are still being used, right? Degeneration, your discs are more flat than before. Let's try to normalize some of that, right? Now we're okay. As we age, expect wrinkles on the skin, right? Our hair grows gray, it may even fall off. But in the inside, we also age as well. So we want to look at the spine as just signs of aging in other ways, right? Osteophytes and degenerative changes are kind of like wrinkles on the inside. Let's say in IPRP, we have this, we talk to our patients how it's okay, society to say, hey, you have degenerative joint disease or degenerative disc disease, right? To describe what's going on in your spine. But will we ever go up to someone and say, hey, you have degenerative face disease, right? Because we have wrinkles? It doesn't sound very nice, right? So again, we want to normalize what's going on inside our bodies as we age. So again, bones adapt in response to the loads they absorb during specific activities over a lifetime. So we want to kind of view the osteophytes or the spurs that, as you see in this image, they're just kind of like calluses on the inside, right? If I work with my hands often outdoors, my skin will toughen up and get calluses, okay? Because of the demand I impose my hands to. So same thing with our spine, right? Every time we walk, we lift, every time we do something, our spine do take up loads, okay? And our spines are designed to do that. And in time, it will adapt, right? Kind of like the orca whales I just showed, right? So we all adapt. So the human body is more like a tree than a car, okay? So it's resilient, it's robust, and it's adaptable. So in this image, there's a tree that shows that it's growing over a guardrail, right? Okay. Whereas the other tree to is right is not. So we suggest that the tree growing over the guardrail is less healthy than the other one. I actually may even argue it actually is doing quite well, right? It's adapting to its environment, okay? So again, going back to how a spine and a body really, we're constantly adapting, okay? So again, we're resilient, robust, and adaptable. Now to illustrate this, because we want to tie it back to pain, right? We want to normalize what we see on a scan. Now, we can't predict pain by looking at scans, right? Looking at X-ray. If we see an X-ray and see a lot of changes, we can't definitively say that person has pain. So in this study, they looked at 33 articles that looked at imaging of asymptomatic participants. So these are people who have no history for back pain, right? Total of about a little over 3,000 participants was in the study from 33 articles. And they broke it down in the ages, right? Age 20, 30, 40, 50, so on, okay? And I just want to highlight just the disc bulge here, right? The disc bulge, okay? So, and again, remember, these are people who have no pain or history of back pain. And even at 20, in the 20-year age group, the scan showing 30% of a disc herniation already, okay? If you look at the other conditions, right? The loss of disc height, 24%. And then as we age, right, 30, 40, 50, so on, that percentage does increase over time for all conditions, okay? So the take-home message is, we want to look at the results of our scans with a grain of salt sometimes, okay? Now, we're not suggesting scans and X-rays and CTs and MRIs or useless. No, they actually give us a lot of information. So moving on about the 10 facts about back pain. Persistent back pain can be scary, but rarely dangerous, okay? So we know that only about 1% of low back pain are medically serious, such as fractures, cancers, or infections. Getting older is not a cause of back pain. Persistent back pain is rarely associated with serious tissue damage. So we look at the saying here, it's seriously painful, but usually not medically serious. Scans rarely show the cause of back pain, as we just talked about with the study. Pain with exercise and movement doesn't mean you're doing harm. And later on in the slides, we're going to talk about exercise dosage, soreness, right? What is to be expected. Back pain is not caused by poor posture. Back pain is not caused by a weak core. Backs do not wear out with everyday lifting and bending. Pain flares don't mean you are damaging yourself. And lastly, injections, surgery, and strong drugs usually aren't a cure. They may help short-term, but long-term, it may not be as helpful, okay? So those are 10 facts about back pain, okay? So yeah, backs do not wear out with everyday lifting and bending, right? And this may be some messaging that maybe, oh, but even my PTs in the past have told me that or suggest that, or doctors, right? So remember, our backs are resilient. It's designed to move, it's designed to compress, it's designed to rotate, etc. Okay? Now we do, as we age, do see those calluses on the inside, right? That's a fact, but remember, that does not necessarily mean or always equate to pain, okay? Spine movement and loading is safe and builds structural resilience when it is graded. And the key word there is graded. So we want to always go on a graded approach, right? We don't go fast and hard, slow and steady. So let's talk about disc a little bit more in detail, okay? So I think oftentimes when we talk about disc, we've kind of visualized something as insecure or fragile or vulnerable, right? Okay. So you may even have an image of a donut or a jelly-filled donut, right? So something that's kind of easily kind of squishy, very fragile. But let's change the narrative of what discs are, okay? So let's look at disc instead of looking at it as like a jelly-filled donut, let's look at them as more like as a living, adaptable force transducer. Okay, so force transducers are designed to absorb loads and respond to loads by adapting and changing shape. So if you look at the image on the bottom right, so let's look at this as more of that structure than the jelly-filled donut, right? And these structures, these force transducers, love movement and love compression. Okay, now remember they're designed to take on all this load, right? You can even argue if you don't get these type of compression or movement, or this can actually become less healthy. I do want to talk a little bit more about the biopsychosocial approach, and this may have been talked about in previous lectures. So here, especially in the VA, the IPRP program, we look and kind of attack pain via this approach versus a biomedical. Okay, so in the biopsychosocial approach, we do consider the biology. Yes, that is very important, right? If a back hurts, we got to look at the back, look at the structures, the spine, the bones, the nerves, muscles, fascia, right? Very important. But we know in pain, especially in chronic pain, it's not just tissue specific. We got to look at the whole person. We have to consider this psychological part of pain, right? How the person thinks about the pain, the beliefs and attitudes, the mood, the past trauma experiences, and the emotions. Expectation would be here as well. Okay, and also the social factor, right? How much social support we have or not have, our family background, culture, and traditions come into play here. The different cultures may kind of view pain a little bit differently, right? Socioeconomic status and education. So we want to look at all three of these factors, especially in chronic pain. And just looking at the tissues itself is not enough often. So this segues into what we call the whole person physical therapy, right? So you ask yourself, and we also ask the patients, like, do you feel safe to move, right? After having back pain, acute versus chronic, oftentimes pain really impacts one's ability to move, because who likes to be in pain, right? We tend to guard, etc. But eventually we do want to, stop moving, right? We can't guard forever. But it's easier said than done. Okay, so one of our jobs is to educate the patients that it is safe to move, even though it is very scary. Okay, but it's okay to bend slowly, gradually. Okay, and also you want to consider all your healthcare providers communicating around your pain. Right, going back to the interdisciplinary approach, we want everybody on the same page, basically. Right, the messaging is very important with pain. Do you have the resources to be successful with your low back care? Resources such as different programs, even these series of lectures that could be very helpful. Also, I want to add how up to date are your current providers with pain, knowledge, and education, right? So you do want to find a provider, ideally, that understands pain, the complexities of pain, the most up to date. Okay, and hence, your outcomes could be a lot more successful. So again, whole person PT. Okay, not just as simple as do the exercise. How has this pain impacted your function? Not just activity, right? Has it impacted your ability to socialize, engage with other people, your relationships, perhaps, right? When you're in a bad mood or when you're stressed, does the pain go up or down, right? We have to consider all those. So that leads us to, in the VA, we have what we call the whole health circle. So we can kind of, let's talk about this a little more in detail, okay? So the patient, okay, or me is you, okay? So you're in the center. And around it is mindful and awareness, okay? Very important, right? We want to identify and be mindful of a situation. And here's what I want to really focus on, right? You see all the bubbles around you or me, okay? Let's start with the surroundings. Now, we have to consider someone's surroundings, right? The environment, whether it be physical, emotional, how that may impact pain. What about your personal development, right? Your personal life, work life, your goals, right? Those are very important. Food and drink, right? Nutrition is very important to discuss regarding pain. Are you getting enough sleep or rest, right? The recharge bubble. Now, how about your family, friends, and coworkers, right? The people around you, very important, right? Do you feel listened to? Do you surround with people that are empathetic to what you're going through, or not, right? It can have a vast impact on you. Spirit and soul, right? Now, this doesn't necessarily mean you have to be religious, right? No, this is maybe having a feeling of there's something bigger than us, right? Growing and connecting. Power of the mind, right? Relaxing and healing. The mindfulness and meditation can live here. And lastly, working your body, right? Energy and flexibility. This is where exercise and movement engages or lives in. Now, I want you to look at all these bubbles. And if you're ever in pain or even chronic pain, back pain, how that pain has affected each and one of those bubbles, right? So chronic pain does have a ripple effect that can impact all those bubbles. And that's why when we approach healthcare, PT, also, we gotta look at the whole person, right? You can't just look at, oh, your back hurts, we just go to the back. We gotta consider all the other factors that may be impacted by pain. And surrounding that is conventional and complementary approaches, prevention and treatment. That's where your providers live, right? In the area. And then around it is the community, right? The community is very important. We engage in with a community. And again, think of how chronic pain can impact all those, okay? And at the VA, this is how we approach healthcare and PT as well. So let's talk about this study here. So since we're talking about movement and exercise, right? And we're also talking about how pain is very complex, our belief system, expectations, and can also factor in how outcomes may be. So this study actually looked at, they had two groups of participants. Both groups work in the same field, right? It's a combination of hotel housekeepers, building maintenance workers, etc. And they work on different ends of the campus, so they don't have any interaction, but they have the same duties. So what they did was, for one group, they told them, hey, guess what? Whatever you're doing, pushing, pulling, lifting, that's considered exercise, okay? The other group wasn't told that. They were informed that, hey, whatever you're doing is considered exercise. And then about a month later, they came back, and what they found was very interesting. The group that was informed that what they're doing is enough, right? It's actually considered exercise. They found that that group had a significant reduction in blood pressure over time. The informed group lost an average of 2 pounds over 4 weeks, versus the group that wasn't informed, even though they had the same duties. The informed group had a significantly healthier, as measured by the body fat percentage or the BMI. So actually, physically, they actually had a change, right? So priming for positive beliefs can actually improve our health. And this is one of the example of the flyer that actually they put in the locker room for the informed group. Like, did you know your work is good exercise, right? Vacuuming 15 minutes burns 50 calories. Bagging, carrying trash for 15 minutes burns 50 calories. So they were told that, and 4 weeks later, they actually had a different measurement physically, right, for the better, versus the group that wasn't told that, even though they did the same amount of work. Now, why are we presenting this? I want you all to give yourself more credit for what we're doing, okay? I know that we're not saying exercise is bad, you shouldn't exercise, right? No, but instead of looking at exercise and movement and chores as two separate things, why don't we put the exercise inside the overall movement bubble, right? So all movement counts is actually what we're proposing. So give yourself credit for doing housework, going outside for that hike, walking around the block, dancing, gardening, childcare even. Well, you may be doing a lot more than you give yourself credit for. Again, I'm not suggesting to stop going to the gym, right? If you find that that does give you value and you enjoy going to the gym, yes, that is very helpful and beneficial. But how often have we kind of came home and go, man, I'm so tired, I really don't want to go to the gym tonight. if you think back on your day, you may have actually walked a lot of steps, right? You may have done a lot of errands. All that in our mind counts, okay? So all movement counts, okay? That's our motto. So we want to look at movement, kind of like how we look at nutrition, right? If you ever have experience with nutrition, this or a dietitian, variety is the best, right? Get your portion of carbs or sugar, etc., fruits and vegetables, meats and proteins, right? So we all know that being an omnivore is the best, right, for nutrition. So we're going to propose, let's be movement omnivores. Let's look at movement like we do with nutrition. So go back to the orca whale, right? The orca whale in the previous slides. Okay, the orca whale in the wild has more variety, right? And hence the dorsal fin looks a lot different than the orca whale in captivity. Now, I think a lot of you may be wondering, well, how much is enough, right? Okay, so let's talk about a little bit about exercise dosage. Now remember, all movement counts. So we like to use the rule of 10, okay? And this is from the source Core Kinetic. So on the left hand, on the left image there, you see what we call is the board scale. Is a perceived exertion scale. So 0 would be at rest. Let's say if I'm just sitting, I'm not doing that is an exertion rate of 0. Right, and then as we whatever we're doing, as it becomes more hard, right, a rate of perceived exertion would be at 5 or 6. And then at level 10, it's almost like that's maximum. That's the hardest thing you ever done, okay? And then we also have the visual analog scale of pain, which I think many of you are familiar with, right? If we go to the clinic, give me a scale from 0 to 10, what is a pain? So for example, let's say your back pain is at a 7, then you can allow yourself to do an activity that is kind of moderate, right, at a 3. So we kind of do the rule of 10. Whatever that activity may be. It could be walking, lifting, riding a stationary bike, whatever that may be, right? So you can kind of get to a moderate level if you have a level 7 pain. If you have a pain level of 2, right, then you can maybe go up to 8 on the activity of the exertion, okay? So sometimes the rule of 10 may help people to, okay, I think this is the right amount of exercise or movement for me, okay? Depending on the pain. Now you notice that even with pain, we do encourage people to move, right? So we feel like using this scale would be helpful for someone to gauge how much to do without doing too much, where they do flare themselves up, and also if they're doing too little, right? Okay. And many may even experience some soreness afterwards, right? So we want to monitor the response to that dose. So after about 0 to 48 hours, usually you may feel something, maybe in the form of soreness. So for example, if it's well under acceptable level, okay, again, this is very subjective, right? Then the next time you do the activity or exercise, you can increase the dosage, right? Maybe do something a little bit more, that is more exerting, okay? If you feel like, that's the soreness of what I'm feeling is at an acceptable level, just keep it the same. Don't change anything. Let's say if you walk 30 minutes, and you feel like, that's about right. Just keep it at the same level amount of activity. Now, if you feel like it's really sore, maybe even discomfort, even pain, over the acceptable level, then you definitely want to decrease the dosage, okay? So again, this is just a little guideline to kind of monitor how much is enough, how little is too little, or just right. You also want to talk about delayed onset of muscle soreness, okay? So sometimes it may be hard to tell the difference between pain that is related to soreness, such as a pain flare from overdoing it, and actual pain that is related to tissue damage, okay? So after exercising, we do often expect some soreness, right? So, and this delayed onset muscle soreness, or we call DOMS, or for short, is a normal inflammatory reaction in your body. It means that your tissues have been stimulated to get stronger and becoming more resilient. And DOMS can help the body get stronger and better able to tolerate activity. So remember the ability, the resiliency of our tissues, right? So we can adapt in a positive manner, knowing that the movement is safe, right? Most movement are safe. Now, if we do feel high level of discomfort, right? Sharp localized pain, now that's different. That may suggest some tissue damage to the muscle, like a strain or a tear even, or the connective tissue, okay? So that's very different than actual soreness, okay? So we have this phrase that we use often in our classes, sore but safe, right? Hurt does not equal to harm. You may work to the point where you may have a pain flare, and even that we're not too concerned about, because we know that those flares can and will decline. So it's just the body's way of telling you, next time maybe ease off a little bit, okay? But soreness is okay. So what can you do for your spine health? So active management, right? So active management meaning you're doing something actively. And that doesn't always necessarily mean actively doing something, right? You could be sitting here engaging with me and other providers and learn about pain. That's active management. Versus passive management, right? Passive would be having something or someone doing something to you, like massage, TENS, electrical stimulation, injection medication. And that's okay, right? There's a time and place for passive approaches, but we feel an active approach is really what's going to kind of help patients get over that hump, especially in chronic pain. Motion is lotion. So remember, all movement counts. So give yourselves credit for what you're doing already, okay? Find value in the activity that you're doing. So remember, what you're doing is movement. Whatever you find valuable. Well, if you love doing chores, right, doing laundry, I don't. But if that you find it valuable, yes, that counts as movement. So always work your goals towards activities that you find valuable. And again, the national recognition for physical activity is currently at 150 minutes per week, right? Comes out to about 30 minutes per day for 5 days, right, if you separate it that way. But remember, a lot of the things that you're doing also counts, okay? So we don't always have to like lock ourselves into those 150 minutes. You actually may be doing more than that, okay, already. And then we know that time improves most back pain, okay? And again, less than 1% of low back pain are medically serious. And again, we like this phrase, seriously painful, but not medically serious. So I hope that gives you a little more confidence that even with pain, we can slowly start moving to kind of help the back start engaging in the activities that you value and start living again, right? Especially in chronic pain. And here is this is where Katrina would come in and talk about yoga, because she in addition to VR, virtual reality, yoga has been found to be very helpful in low back pain. So these are some things that are maybe a little bit outside of what you think about traditional PT, like exercise education. So studies have found with yoga and mindful movement, it has really helped a lot of low back pain and depression. PTSD, there's not enough studies to really show a significant impact, but it does show a lot of promise, even for people who are suffering from PTSD, that yoga and mindful movement can help greatly. But we do need a little bit more research regarding that subject matter. And then VR, right? Virtual reality, right? So we're talking about kind of thinking a little bit outside of what traditional PTs do with exercise and education. Virtual reality is something that you may engage in even now, maybe even more so as we're moving along with technology. There's a study, a trial out of Stanford, about 180 adults, mean age of about 52, all with low back pain with greater than 5 years. And after they went through some VR treatment, they found that there was a significant symptom reduction with virtual reality, with mood, stress, and activity interference. So, for example, some of these applications that are in the VRs it's actually kind of fun, right? We kind of get you to kind of reach, for example, right? Reach down, and you can see how helpful that may be for someone who may be very fearful of moving the back because of pain, right? like bending or twisting, for example. And being in the VR environment gives them a little bit of a safer space to do that. And then the most important thing, it carries over into their everyday function. So VR, yoga, it's been shown to be very effective. And don't be surprised if you start seeing these as a mode of, that's part of a treatment plan if you do engage with PTs or the doctors even. Very exciting things to talk about. So with that said, I do want to spend maybe 5 to 10 minutes and talk about some simple exercises that may be helpful to you all, okay? So the first one I'm gonna do is called a pelvic clock, okay? So I'm gonna actually stop sharing so you can kind of focus on me, okay? So pelvic clocks, so you can do it in sit-in, and just pretend that you sit it on the face of the clock, right? So 6 o'clock would be 4, 12 o'clock, 3 o'clock, 9 o'clock, etc. Okay. So working on some pelvic tilts can help with spinal movement. So remember going back on the fascia, right? Stiffness. So you can just gently tilt your pelvis into 6 o'clock, 12 o'clock, right? We can start getting our spine to move. The extension, when we go to 6 o'clock, 12 o'clock, your spine is flexed, right? Just do that maybe 5 to 10 reps, okay? Especially for those who have are sitting most of the day, right? Here's a desk job like me. So doing a few of these may be very helpful during the day, okay? Pelvic clocks, 6 and 12. Now the clock also has 3 and 9, right? So we can go to the 3 o'clock, 9 o'clock. And this will help with some side bend, okay? Side bending. Now the clock has more than 6, 12, 3, 9, right? It has a diagonals, right? So you can go into, let's say 4 o'clock and 2 o'clock, right? No, 10 o'clock, sorry. Okay, I always get it mixed up. Okay, do the diagonals, the other diagonal. And then lastly, go around the clock, right? Get your pelvis to move around the face of the clock. One direction, and then reverse the direction. You can even make bigger circles or smaller circles, up to you, okay? Be creative in your movements, okay? So we love pelvic clocks. It's easy, it's effective. You can do it just about anywhere, right? Even do it in sitting. I had a patient earlier today, was telling me, hey, I should do pelvic clocks when I'm driving, right? When I'm stopped at a stoplight. Next one is just doing some rotations, right? So remember, a spine all designed to flex, extend, and rotate. And again, if you do have pain, just go to where you feel comfortable. But we definitely don't want to push it beyond where you can you feel comfortable. Okay, so just go as far as you feel comfortable. Hold it for a couple of seconds and reverse. Okay. If it's really painful and really uncomfortable, ease off a little bit. Okay. But if you feel like, oh, there's a little bit of pain, it's not too bad, you can push it a tad. So nudge it a little bit, okay, without blowing past your edge. We call it edge or your limit. Okay. So just doing a few rotations could be helpful in addition to pelvic clocks, okay? Another thing that we like to do is just doing some simple shoulder shrugs for neck, okay? So, but instead of doing this, we don't want this, that's too tense. Think about your collarbone, kind of going for elevator ride, okay? So collarbone just gently going up for elevator ride and gently coming back down, okay? So it's very gentle movement here, all right? And of course, the neck, we can also move the neck, right? Rotations, very gentle, side bend. Just really go where your neck and your joints allow you to go. And again, for those who may be in pain, just go to where you feel comfortable, okay? And then lastly, I want to show you a quick way to stretch your hamstring, also sciatic nerve, okay? So I'm gonna put my camera down a bit. Very easily, right? You can extend one leg out so the heel is still on the floor. Keep the legs slightly bent. You don't want it straight. Keep it back straight and lean forward and you feel a little bit of stretch in your hamstrings, okay? And then from here, pump your ankles up and down. What this is doing is kind of helping to glide that nerve, right? Okay. Do 5 reps. 5 reps feels okay. Do 10. Remember the exercise dosage we were talking about before? And then you can reverse. Okay. Lean forward, feel a little tension, and then pump your ankles up and down. Some of these may be uncomfortable, but again, you're in control, right? Ease off if you need to. And then really monitor the effects of soreness or even pain later, and then adjust your exercise doses accordingly, okay? And with that, I have come to the end, the conclusion of my lecture.
Thank you so much, Dr. Chan. We really appreciated that. And especially thank you for showing us some of those exercises too. I know we do have some questions in the chat. And I think, one of the questions has to do a little bit with some of the exercises that you just kind of showed us, but I know a lot of us spend a lot of time sitting, perhaps working on the computer, and it's not uncommon that a lot of us will get low back pain. Assuming there's not any medically serious condition causing that back pain, are there certain kind of like therapies that you recommend more in the longer term for things that we can do to just improve low back health?
Okay, so not specifically for someone who sits off, it's kind of overall health. Yeah. I would say again, like any movement is beneficial, right? So let's say we do sit often, every 30 minutes, try to get up, right? But we understand that some of that may not be realistic. So doing some of those pelvic clocks may be quite helpful. Even some seated stretches for your hamstrings, pumping your ankles could be helpful. Really engage. We also really encourage people to just engage in activities that is very valuable to them, that they find important, right? It could be as little as just walking around the block in the evenings with a loved one. That could be helpful for low backs, right? I understand there's a lot of exercise that really focus on core strengthening, getting your abs tight or stretching. I think those are okay, right? At the same time, especially with chronic pain, we gotta be a little careful, right? Sometimes we always just instruct people to be always in the correct posture. That actually can become counterproductive at times. Okay, they actually may guard even more. They may start thinking, well, if I'm not in the correct posture, if I look at my core strong, it's going to equate to pain, right? We've got to be very careful with the messaging. So we here, especially in the pain clinic, we really offer, go out, do things that you enjoy, that you find valuable, right? Whether that be fishing or walking with a loved one or going to the gym even, right? Stationary bikes. So I feel like any movement will help with back pain, right? So yoga, right? Can be quite helpful. Tai Chi, I've often heard a lot of people talk about doing Tai Chi as well. So.
Thank you. And I think one very interesting thing you talked about that we haven't really heard much about in the lecture series so far was just about fascia and its importance in the human body. I think you mentioned a couple things specifically that can address that, like the foam rolling and stretching. But I was wondering if you can talk a little bit about like just certain therapies that people might consider just to help improve the function or the health of the fascia.
Yeah, so in addition to foam rolling, right, which applies the compression that fascia loves, right? Just stretching, right? And stretching doesn't have to be just doing a hamstring stretch. Have we ever seen a cat or an animal stretch, right? They just go to where they feel good, right? So again, we encourage a lot of creativity, but there's really no right or wrong in doing a lot of these movements, right? So if I kind of do this stretch, you can say I'm helping with the fascia, right? I can go multi-directional even, right? So I find that a lot of like PTs even, right? They teach exercises where it's very kind of locked in, right? There's only a specific way to stretch a hamstring or your calf or your back. But let's kind of reframe how we're thinking. Now, let's just go where our bodies feels good, right? Now, we're built to do multi-directional type of movements, right? So why can't we do a stretch that is geared more towards those multi-directional movements, okay? Kind of like a cat or an animal, how they stretch, okay? So we feel like that would be a really great way to get a fascial system to be very a little bit more healthy or hydrated.
Sometimes a pain physician's approach to managing low back pain it does include a variety of therapies, maybe medications or recommendations for certain mind-body therapies or even injections or procedures. These are kind of some of the things we've talked about in the past few weeks. If a patient is undergoing maybe various therapies for back pain and also sees a physical therapist at the same time, how does that change or does it change your approach to that patient?
Yeah. So I look at like medication, injections, so forth, as a way to maybe calm the nervous system down a little bit more so they can engage in a little bit more activities, right? So it may not change how I approach it. If they're really sore, I may say, hey, take a little easy. Next time I see you when the soreness from whatever procedure they have experienced, once it calms down, then we engage into these movements. So that's how I approach it. So it really doesn't change how my treatment plan for them. But there is value in injections and medication, for sure, right? Kind of, I look at it as almost like a kind of having like Kickstarter, right? So patients can kind of engage a bit more with the actual activity.
Yeah, that's a good point. I think sometimes if we can see sometimes injections or procedures can be helpful, and maybe it can be helpful to help kind of tolerate a little bit more movement and gaining strength.
Yeah.
Another interesting topic you talked about was bioplasticity and how it could be a good thing where doing physical activity can lead to increased strength, but also it could be a bad thing if you don't use it, you kind of lose it. As a physical therapist, are there ways that you kind of help assess for some of those positive bioplastic changes in patients?
Yeah, so specifically, you can go into detail like actually measuring muscle girth, right? or range of motion, right? If someone comes in with a lack of range in certain joints, via exercise, education, movement, and in time, we do want to see adaptation in the form of bigger muscles, strength, range of motion, and then to me, most importantly, how are they moving, right? The expectation would be if that happens, they're going to be moving more efficiently. The gait or the walking actually may look more normalized, right, compared to maybe before the therapy has started. So that's bioplasticity in action, right? Positively. Right?
Yeah, the good side of it.
Yeah.